بسم الله الرحمن الرحيم. نتكلم النهاردة على important subject pruritis vulva and vaginal discharge. نتكلم الأول على pruritis vulva. What is the definition? It is a strong desire to scratch vulva, irresistible desire to make itching in vulva. Etiology: there is two main groups. Itching accompanied with discharge and itching without discharge. First, itching with discharge caused by any infection, vulvovaginitis, most common candidiasis and trichomonas vaginitis. Second group is itching without discharge. There is a lot of causes to cause itching without any discharge. Beginning of general cause, like any general disease like diabetes mellitus, renal failure, obstructive jaundice, any dermatological disease like eczema, scabies, and pediculosis. Also contact dermatitis. There is also vulval dystrophy. What's meant by dystrophy? It is non-neoplastic, non-infectious group of disease in the vulva. The most dangerous is vulval carcinoma. Also, the neighborhood organs, urinary and rectal causes like urinary incontinence or ringworm. The last one is idiopathic. There is no apparent cause to the itching. How to treat? Mainly treat the cause. If we reach diagnosis the cause, this is to a great degree solve the problem. Also, there is a local measure to be used, as good hygiene, cotton underwear, calamine lotion, topical steroid. If above failed, we resolve to general treatment in form of antihistaminic, neuropathic pain, respond to gabapentin to decrease sensation of the nerve, sedative and hypnotic, especially at night, and local estrogen. If the all above fail in severe cases, we may need surgical treatment in form of subcutaneous injection of absolute alcohol to kill nerve ending, or lastly vestibulectomy in a resistant case. Second symptoms important: vaginal discharge. Before we proceed to abnormal vaginal discharge, we should know what's normal vaginal discharge. A source of the normal vaginal discharge from all genital system, beginning from the vulva, bartholine gland, sweat gland, sebaceous gland, from exudation from the vaginal epithelium, from the cervical gland, and even from endometrial gland and fallopian tube. Normally, vaginal discharge increased during ovulation, mainly from endocervical gland, before menses, premenstrual phase due to pelvic congestion, during pregnancy, and lastly during sexual excitement, mainly from bartholine gland. How to differentiate between physiological discharge and pathological? This is important. إزاي نفرق بين ده normal ولا abnormal? Physiological has three criteria: it's colorless, odorless, and does not stain underwear. If one of the above lost, we shift to pathological discharge. Pathological mean either excessive in amount, or have bad odor, or have abnormal color. What is the causes of pathological vaginal discharge? Two main groups, either due to infective cause or non-infective cause. Non-infective cause, any irritant to the tissue like chemical doushes, spermicidal, foreign body, especially in children, cervical polyp, if there is genital malignancy, we see a very offensive necrotic discharge, or in presence of fistula, either with the urinary system or rectal system. Infective, either infection في vulva and vagina, vulvovaginitis, or cervicitis, or bartholine abscess. Mainly the causes due to infection, most common and most simple. The most common one is bacterial vaginosis, characterized by, we know, homogeneous, malodorous, frothy white vaginal discharge, الكوز بتاعه overgrowth of multiple organisms, combination of multiple organisms, combination of aerobes and anaerobes like Gardnerella vaginalis, mobilicus, and Mycoplasma hominis. It is mainly disturbance of the flora of the vagina rather than true infection due to decrease in lactobacilli and increase above bacteria. To diagnose it, we need 3 out of 4 following criteria, which is known as AMSELS criteria. First is the discharge should be homogeneous, white, and adherent. Second, the pH more than 4.5. And there should be a positive food test. Release of fish odor from vaginal discharge with addition of any alkaline material like potassium hydroxide. And last one, clue cell. Clue cell اللي هي الدليل. خلية الدليل. What's clue cells? It is large epithelial cells covered by bacteria. Bacilli covering the large epithelial cells. Right picture here show normal epithelial cells. Left picture show clue cells. We notice that the epithelial cells completely covered with bacteria and bacilli. Vaginal candidiasis, second most common causes. We know what the predisposing factor or risk factor. Most common diabetes, pregnancy. If we use broad spectrum antibiotic, combined oral contraceptive, and lastly steroid therapy. Pruritis is most common symptoms. The criteria of discharge here: sick, has no odor, but cheesy like. الست بتوصفها تقول لك يعني في discharge أو في فرازات زي الجبنة كده. Associated with vulvar candidiasis, dyspareunia, vulval dysuria. The third most common or least common trichomonas vaginitis. It's sexual transmitted disease. الdischarge هنا بيبقى more pruritus عن الأنواع اللي قبل كده. ولو احنا عشان نشخصها accurate نشوف under microscope motile or fusiform protozoa. ده شكل البروتوزوا under microscope. عايز ارسم. We notice multiple flagellae. Non-infective cause most common foreign body. ده بيحصل أكتر في children. ممكن any type of foreign body piece of حتة ورق مثلا أو any toy ممكن في children ممكن تبقى as a foreign body. في الأدلت بيبقى ال contraceptive device أكتر حاجة، البسري، التامبونز. Pruritis بتؤدي إلى pruritus vaginal discharge, very bad odor, maybe bloody نتيجة التروما by foreign body. المشكلة بتقابلنا في الناس الفيرجن children how to diagnose. ممكن نستخدم النيزل speculum to separate الhymen gently و see the foreign body. If removal easily remove it then antiseptic. ممكن نستخدم الهيستروسكوبي طبعا لو احنا خايفين من أو ما قدرناش نستخدم الآلات البسيطة دي ممكن نستخدم الأوفيس هيستروسكوبي. urinary and fecal discharge. Urine discharge طبعا any fistula with urethra with urinary bladder with ureter. Fecal discharge زي الlectovaginal fistula. Thank you.